It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome to another edition of the Best Docs Network, featuring some of the best doctors and procedures in the Dallas-Fort Worth area, helping change people's lives.
That's right, like our first doctor, weight loss surgeon, Dr. Philip Swanson.
Before I went to see Dr. Swanson, I was 200 and something pounds. I had a 2-year-old little girl. I was on the sidelines a lot. You know, I was that big parent, not very healthy, not very active, and I wanted to participate more with her in her life and the things that were going on with her. She was 2, she was walking, running, and very active. So that's what drove me to go see Dr. Swanson.
The advantage of the sleeve is that when you remove that part of the stomach, you change the communication of your insides. People think of the stomach as just a bag to hold some food, and it makes some acid, and yeah, there it is. No, the stomach is an amazing organ. It manufactures several hundred chemicals that communicate to the pancreas and the liver and the brain and the fatty tissues. And all that communication goes on all the time. So when you remove part of the stomach, you change that communication, and that's when amazing things happen.
Within 2 weeks, 3 weeks of the surgery, I'd already had dramatic weight loss. To date, it's been a year from my surgery and I've lost 120 pounds. Life has changed dramatically. When I go to the doctor, my doctor is just floored at the progress that I've made.
People seem to have a place where they live as far as their weight. They've been 300 pounds for the past 10 years. Their stomach and their brain and their fatty tissue communicates and says, you need to live at 300. When you change that communication, on the day of surgery, their brain now thinks you should weigh 160. When your brain thinks you should be 160, and it's getting the signals from the fatty tissue saying, oh, we got all this extra reserve out here, the brain says, we got plenty of energy. We don't need to eat. And these people are not hungry. It's amazing.
If I hadn't had the surgery, I don't know what it would be like, to be honest. I mean, I wasn't there. I work out 3-4 times a week and it's not hard and it's easy now. And before it was just so hard, it hurt my knees, it just wasn't fun. And now I can go to the gym and I don't mind wearing the gym clothes and it's great. It's fantastic.
So reflux disease can be treated initially with taking medications. Antacids, over-the-counter medications are very common. When your reflux becomes more severe, then people tend to go on to medications on a daily basis, which is really not what those medications are designed for.
I was always having to worry about taking medicine, having the medicine with me, and really had to watch what I ate. I had the heartburn and everything for about probably 5 or 6 years before I finally went to the doctor and did something about it.
Medications are really a chemical treatment for a mechanical problem. We're chemically changing the composition of the fluid, but we're not changing the mechanics that keep the fluid in the compartment where it's supposed to be. And that's what surgery does.
When I went to see Dr. Ihde, he explained to me what was actually going on, and then we just set up a scope to go in and check and see if I did have a hiatal hernia and what exactly was going on.
The fundoplication procedure is done with a new device called the esophagus device. And we pass that with a TV camera into the mouth and down the esophagus into the stomach. And then it folds back on itself so that we can attach to the junction of the esophagus and the stomach. And it has a flap that will fold the fundus part of the stomach onto the esophagus and then put the sutures in.
The surgery went in and corrected the hiatal hernia where the stomach had gone up through my diaphragm, and he fixed that. And then the transoral incisionless fundoplication rebuilt the valve so that the stomach acid couldn't come back up my esophagus.
We usually have them on a 2-week diet of liquids, soups, and then we spend the next 4 weeks with soft foods. And then at 6 weeks they can go back to eating the beef, chicken, raw fruits and vegetables, those sorts of things that are a little harder to get down and would put more strain on the repair.
I'm not in pain every day. I don't have to worry about when and where I've got to take medicine. I can eat whatever I want. It's been great. It's changed my life for sure.
Cindy had trouble losing weight until she met Dr. Kim. To find out more about Cindy's story and other life-changing stories, log on to bestdocsnetwork.com. Best Docs Network DFW is presented by Forest Park Medical Center. Extraordinary is all we do.
Before I came to see Dr. Pero, I was suffering with chronic sinus infections and congestion and facial pressure, pain. So my family doctor had referred me to him to correct these issues.
When a patient comes in and complains of not being able to breathe, you have to address it in 2 different manners. The first is, do they have a functional problem? Is there something that is going wrong with how the nose is supposed to function? And the second one being, is there an architectural problem? Is there physically something in the way that needs to be corrected in order to improve the problem?
After Dr. Pero examined me, he ordered some imaging studies, and this showed that I had a deviated septum.
So when Ann first came in to see me, we talked primarily about the function of her nose. She had a pretty severe deviated septum to one side that was clearly blocking not only her airflow, but was also contributing to some recurring sinus problems that she had. And so ultimately we discussed correcting the deviated septum to correct not only the airflow through her nose, but also to help her with her sinus problems. At the same time, she had concerns about the external appearance of her nose, and so we addressed performing those at the same time, which for a number of reasons is not only easier, but technically beneficial to do at the same time.
Along with the surgical procedure for the repair of my deviated septum, I inquired if Dr. Pero could repair a small bump that I had on my nose. All of my family has it on my mom's side. I've always been extremely bothered by this bump, and he said sure, it would be a very simple thing to do, and I'm very pleased with the results.
So ultimately we did that. We addressed not only the outside shape of her nose while also addressing the inside of her nose. We were not only to improve her nasal airflow, but also correct her chronic sinus problems as well.
I'm forever grateful to Dr. Pero for fixing those issues and getting rid of the bump, helping with my self-esteem and loving my look a lot more.
Recovery is well tolerated. Typically we tell patients to expect to be out of work for 3 or 4 days. That could be up to a week in some patients' cases, but it just depends on the patient.
Dr. Pero and his staff, they're very helpful, and this made me feel very comfortable and confident going into the surgery.
We have an epidemic of diabetes going on in America at this time. Diabetes is high blood sugar. Normally, your blood sugar should be less than 100. We define diabetes as a blood sugar of 126 or higher. If you have a blood sugar of 100 to 125, that's called pre-diabetes. If you don't do something about it at that point, it will develop into diabetes almost for sure. What's bad about having diabetes? Well, it damages every blood vessel in your body. That can result in vision problems, even blindness. It can cause kidney failure and heart attacks or strokes. None of those are good things. To prevent or treat diabetes, the best thing you can do is lose weight. That will help the most. Also, eating an ADA, that's an American Diabetes Association diet, will help. You can find that on the internet at multiple websites. So if you have high blood sugar, exercise, eat right, and things should get better. Remember, sugar is sweet, but you don't want to be too sweet.
Mike, who loves his job working at a hospital, had chronic neck, shoulder, and back pain until he met Dr. Peter Beck. To find out more about Mike's story and other life-changing stories, log on to bestdocsnetwork.com.
woke up on a Sunday morning and I had this awful pain. And it was like I was hurting everywhere. But I knew it was like my head and my balance. I couldn't get my balance. So I told my wife, I don't feel good. I think you need to take me to the hospital. Went in and a surgeon on duty examined me, and they gave me CAT scans, and when she told me that she saw masks in my head that weren't supposed to be there, and she couldn't tell me exactly what it was, but she wanted me to see a neurologist.
He was having some problems with not only headaches, but not being himself too. Ultimately, he got seen by a neurologist who did an MRI, who discovered the very large tumor, and he was placed on seizure medications and referred to me for resection of his tumor.
Yeah, you got a big one there. She said, but we can handle this, you're gonna be okay. And she started drawing. She drew my skull, and she drew where the tumor was, and she just went to work, and she drew that entire table with pictures of how she was gonna go in and cut it and get it out.
It was very unusual for us to find one that large and that had been that locally destructive of so much of his tissue that it ended up requiring so much more in terms of reconstruction. Because it was not only just the resection of the tumor that was so important in him, but we needed to give him back normal contours so that he looked normal in public after the surgery.
Knowing that she was confident and she knew what she was doing, and everything she told me, that's the way it came out.
And he's been doing very well for many years now. We've never seen any signs of any residual tumor. He sees us about once a year and is doing very well and enjoying a very active lifestyle and enjoying his retirement.
I'm blessed. And every day we wake up, I think about her. She did it, you know. That is, that's my way of telling it. Here we are 7.5 years later, you know. That's my best buddy.
The way I met Dr. James, he's actually coaches my daughter's soccer team. He had overheard a conversation I was having with another mother saying that one of my MRIs had come back and that my thyroid didn't look quite right, but I really wasn't putting a whole lot into it because I didn't really have any of the symptoms.
Patients with thyroid problems can range in two different areas. One is if they have hyper or hypothyroidism and they feel tired, run down. They'll have a change in appetite, sometimes hair loss, and in some cases patients will have a thyroid nodule, an enlarged thyroid, and that's typically when they get sent to myself or an ear, nose, and throat surgeon to evaluate.
After I had all of the tests done, my husband and myself went into his office and met with Dr. James to discuss how we were going to move forward after they had found some atypical cells in my thyroid.
In the case of Ruth, she presented from her primary care as a referral for an evaluation of a thyroid nodule. She underwent a needle biopsy of the thyroid nodule, which showed evidence of possible cancerous cells. We took her to the operating room and performed a biopsy of that portion of her thyroid gland, and during surgery, the pathologist reported that in fact it was a thyroid cancer. We took the rest of her thyroid out in that same setting and removed all thyroid tissue completely.
I really expected to be in more pain. The first 2 days are pretty rough, but after that, it wasn't nearly as bad as what I thought it was going to be.
She then stayed in the hospital for one night and went home the following day, and after approximately a week was back to a normal activity and doing well.
If it wasn't for Dr. James, I think I would have blown it off if he would not have said, hey, this is kind of serious and it's more important than, fixing your neck, and you need to, you really need to put more attention towards this. It's so important, to go and have those tests done, to take that extra step, make the time. With 4 kids, I have an extremely busy schedule, and I just had to put everything aside and say, okay, right now, I'm more important.
For more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com.
Right now, Candace, you know the next place to go? It's our next doctor. It's Dr. Patrick Allen.
That's right.
For me, it was more a matter of we had our son, he was 5, and we were trying to find different options besides birth control. I was on birth control for a number of years and not feeling very well from it, and so we wanted to find other options of permanent birth control because we had decided to just have one child.
The Essure is a way to do a permanent sterilization in an office setting, which is without having to use general anesthesia. When we do the procedure, we do a paracervical block, which is like a local anesthetic we put in the cervix to help the cervix when and you usually don't have to dilate, but when you put your scope through it, sometimes it causes some cramping.
The procedure is they go in and insert coils into your tubes, and over time, it was like a 3-month period of time, that your body just naturally produces a scar tissue.
Once we can see them, we just try to place the coils. There's a little tiny, they're very small. We place them into the tube and then we release them and we go to the other side and do the same thing. And then if it goes well, within 5 minutes you're done.
And then you'll go back in after that 3-month period and they shoot up a dye and they make sure, I mean you can see it, I was able to watch it on the machines where sure enough it had worked.
Probably the biggest advantage is it's just not a lot of downtime. I mean you don't have to put the patient to sleep, they don't have any issues with general anesthesia.
That's what sold me on it, that it was an in-office procedure. I wasn't going to have to be cut on, I wasn't going to have to go under any kind of anesthesia. I'm extremely happy with the results. To know that going forward, you know, I don't have to any longer rely on birth control, remembering to take my birth control, or having the ill effects from it, that it's now a permanent thing and my husband and I can enjoy each other and not have to worry about anything, that we get to enjoy our family of 3 and that's how it's going to be. And so it's been a great, worry-free experience.
For some of the best doctors and latest procedures in your area, log on to thebestdocsnetwork.com. The Best Docs Network brings the specialists right to your fingertips. Check out some of the best doctors performing and talking about their latest procedures, as well as changing people's lives. It's thebestdocsnetwork.com. And also be sure to connect with us on Facebook at facebook.com/BDN Doctor Videos.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
We treat a lot of various diseases that have chronic pain, and musculoskeletal pain is one of the big categories. Within the category of musculoskeletal pain, you have people that have fibromyalgia, lots of other directly related skeletal problems, and one of the more controversial diseases that you have is chronic Lyme disease.
I had been experiencing pain from my head to my toes, and I had been to numerous doctors, and I knew there had to be something different, something better, because I knew I couldn't live this way and I did not know what the pain was. I found Dr. Shaw in 2002. During our first visit, he asked me where my pain was, and I said, there is not a place in my body that I do not hurt. And he said, well, fibromyalgia, you don't hurt from head to toe. He said, have you ever been tested for Lyme disease?
Gloria had several problems. She had the myofascial pain, she had joint pain, and still does. She had what we call neuromatous. She'd had some nerves operated on because of pain. She has severe headaches, and some of her headaches are vascular, similar to migraine.
I get to visit my family that live in Oklahoma. I can make an occasional car trip. I can do things that I didn't think I was ever going to be able to do again. He listens to every ache and pain you have, and because of the medications in his treatment plan, we have got to where I am today.
Several years after we started treating Gloria, One day she came in all smiles, and she said, for the last 2 weeks, I've not hurt at all. In someone that's had chronic pain for years, it's an incredible miracle.
During my visits with Dr. Shaw, one of the things that we have discussed is not only mentally, but physically, to achieve pain freedom. And each visit, I feel like we are getting closer and closer to that objective.
Before seeing Dr. Sorin, I was experiencing awful migraines. I'd seen a lot of different neurologists. I'd seen plastic surgeons. I'd seen pain management physicians. And I'd even gone the non-typical route and seen people like herbalists, massage therapists, and acupuncturists.
Patricia was probably more associated with a musculoskeletal instability and just compression of nerves based on the muscles. And once we started working on calming those nerves down, releasing those nerves, Patricia, we just saw almost 180-degree turnaround in Patricia.
He asked me a little bit about my headaches, and the first thing he really targeted on, he said, well, do you get nausea? Do you have any kind of sensitivity to light or sound when you get your headaches? And I said, no, I don't have any of that. And he's like, well, you don't have a traditional migraine. You have basically what's a tension headache.
Literally, the first time I ever saw her, it was really a do or die because she really was visiting the emergency department maybe 3 or 4 times a month just to get some sort of transient relief based on her headaches.
He did shots on my head and in my shoulders, and he could even say he saw on his machinery how tense and tight that muscle was. 10 minutes after the treatment, I felt 90% better. And I literally was almost in tears because I'm like, this is the first time I haven't been to the ER, had to, take off a day from work.
Every once in a while, we'll get a patient who has a chronic headache that's been going on for decades, and then other times we'll get patients who may come in here who are not headache sufferers at baseline, but they're primary care physicians or the emergency departments around the area. We'll send them in because they have these intractable headaches that may have started, even anywhere as close to a week or 10 days prior to coming in. So we kind of have a multifaceted approach to it. Some patients we can just try and see if we can find the trigger of the headache, try and shut it off while they're in the office.
So he's totally changed my life in that I feel confident being able to take vacation, being able to get on a plane, being able to go. This last September I just visited my sister in Paris, which was an amazing trip, and she's been over there 5 years, so it was nice to finally be able to do that.
Denise's passion is tending to her show dogs, but had trouble doing that due to chronic pain in her hands until she met Dr. Trouble. To find out more about Denise's story and other life-changing stories, log on to bestdocsnetwork.com.
I was 342 pounds at my largest weight and was diabetic on insulin before my surgical procedure, the Duodenal Switch. I also had high blood pressure, high cholesterol, and obstructive sleep apnea. I was on, at my peak, 9 medications.
The Duodenal Switch is a sleeve gastrectomy in which you remove about approximately 2/3 or a little bit more of the stomach, but instead of removing it in a horizontal plane and removing the valve at the bottom of the stomach, you make the staple line in a vertical plane, maintaining the valve at the bottom of the stomach, and then you divide the small intestine, which is the duodenum, just below that valve, and that's where the term duodenal switch comes from. You basically divide the duodenum and switch in the ileum, which is a lower part of the small intestine.
I was at a point in my life where I was well over 100 pounds overweight, and so statistically speaking, diet and exercise, less than 5% success rate. And so I knew for me, it would take a surgical procedure to lose the weight permanently.
And he's just had really good results. He's also become a great advocate of the surgery. After I did his surgery and after he started losing weight, I started getting a steady stream of his patients coming to see me. And of course, they were all very well informed because he taught them about it ahead of time and everything.
I lost my diabetes within a few weeks. Stopped all my medications the day after surgery. And within 6-7 months, had lost the majority of all of my weight. By 9 months, I had stabilized pretty much and reached a low. I started at 342 maximum, reached a low of 159. I've leveled at 170 and stayed there for over 2 years now with no problems.
My approach to all patients is to try to educate them, first of all, about the different surgery options. And of course, Duodenal Switch would be one of those options.
In the last almost 3 years, I think we've had over 40 people come to his practice specifically looking for a Duodenal Switch, just having seen the results in me, seeing the results in my patients and their family and friends.
I lost my teeth and had dentures at an early age in my early 30s, and I suffered from periodontal disease. They were ill-fitting, and I started suffering from burning mouth syndrome.
Susan is a remarkable case because she did lose her teeth beginning at a very early age. She put her dentures in with a lot of glue, went to work, it started to hurt so much, but of course she can't go without her teeth, she has to wear them. So she endures this pain through her workday. Comes home, takes pain medicine, takes her teeth out, and goes to a dark room and goes to sleep.
We talked about the procedure, about removing some of the bone on the top and bottom on the gums so that I could get a proper fit.
We took out the remaining teeth, we placed implants in a bone, and we attached teeth to the implants.
It entails just 4 screws implanted on the top and the bottom. Then the teeth are made with the holes, and they're attached.
We can place the implants, attach the teeth to it the same day, and now they go home and they're using teeth all in one day. That's what's remarkable. That is why implants have changed dentistry.
I would recommend the All-on-4 to anyone that is having any kind of gum disease, loss of teeth, that have ill-fitting dentures.
Her smile is even bigger than it ever was. She went home, she didn't have to take things in and out, she didn't have to use glue anymore, she got off all the pain medicine. She was a completely different person.
I enjoy going out more. I'm not worried about what people, think and being uncomfortable with the dentures. I feel more confident. My husband and I go and do things that before didn't want to do because I was more comfortable at home with my dentures out.
We got to change her teeth to be exactly like what she wanted. It's a great treatment for patients who want to go home with teeth or who can't tolerate dentures. It's an amazing thing that we can do with dental implants nowadays.
Best Docs Network, DFW, is brought to you by Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center. That will do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors as well as procedures in the Dallas-Fort Worth area that help change people's lives. And for more information on any of the great doctors you've seen on today's show, head to the website, bestdocsnetwork.com.
That's right, and if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. So long, we'll see you next week.